Good afternoon, and welcome to our webinar, Why Do Nurses Leave? A Research Study on Nurse Turnover. My name is Tom DeSantis from Laudio, and before I hand it over to our presenters, I want you to know that everything is automatically set to mute. But if you have a question at any time, you can type it into the question box, and I'll gather them and come back at the end of the presentation for Q&A. Let's begin. Today, you've joined us to learn more about the root causes of nurse turnover that have been uncovered by the research team at Laudio. We're a Boston-based technology company that has introduced healthcare's first manager impact platform. Using artificial intelligence, the sample of benchmarks we're about to explore are built directly into our solution, developed specifically for unit managers in their daily workflow. Today, you'll hear from our Chief Analytics Officer, Tim Darling. Tim's a veteran of healthcare technology and our strategy and analytics lead. Welcome, Tim.
Yeah, thank you. Happy to be here.
With Tim is our Senior Clinical Advisor, Dana Obos, an experienced COO, CNO, and Chief Quality Officer who brings to Laudio a deeper first-hand understanding of working in a health system, like the majority of you on the call today. Welcome, Dana.
Thanks, Tom. Hello, everyone.
Together, we've all selected a sample of research results that we feel will resonate with our audience in the 30 minutes that we have scheduled today. On the agenda, Tim will provide context for our work, this topic, and the challenges it poses, explain our own study, and highlight the results broken down into three categories: impact from time and attendance data, impact from shift and certain personnel insights, and impact from career development opportunities. And throughout, Dana will provide her unique perspective based on previous roles across hospital leadership. And then we'll take questions at the end. At this time, I'm going to ask Tim to kick us off with a brief note on nurse turnover.
Yeah, thank you, Tom. Well, we'll jump right in. So we've been working with 12 hospitals now over the last few months, few years, and we've just this chart here shows the average turnover rate across those hospitals now year on year, and you can see that even though turnover has come down a bit in the last couple of years, turnover is still relatively high and is very much a top priority topic for each one of these hospitals that we've been working with.
And the national turnover rate for RNs is approximately 17%, and the nursing shortage is actually expected to reach more than 1 million by 2022.
So with that in mind, Tom, if you take us to the next page, just wanted to jump right into the research that we did and share some of the results of that with you. So knowing that turnover and employee engagement is such an important topic and priority for these hospitals, as it is for many and most of the hospitals around the country, we did this research now looking at over 11,000 RNs. It's across, as I mentioned, 12 hospitals in the United States. Each of these hospitals, we have about between 1 and 6 years of data from them. It averaged about 38 months. And the work that we're showing you is based on original raw data from operational data and human resource records data. These are not the results of surveys or summary totals. Just as a way of organizing the information, we're mostly going to talk about topic 2 today, but turnover can be split into the demographic and effectively unchangeable aspects, and as well as the things that a nurse manager, frontline leader can do and can address. And so today's topic, as I mentioned, is really going to be about what the frontline leader can do. But we did want to show you one chart here up front about the more of a demographic-based impact of turnover before we got into that. So just looking at the med-surg units in these 12 hospitals that we were working with, the first insight is the impact of manager span of control. So again, this is a similar specialty, just med-surg units. Of course, there are variants within med-surg, but just looking within med-surg, we see that if a med-surg unit has less than 50 team members, the average turnover rate on the hospitals we work with is 9%, and it goes up steadily as those teams get larger. The difference there is the span of control and the impact that has on, of course, the manager managing such a large department.
And we all know that today's nurse manager wears many hats, and patients are sicker, budgets are tighter, and the nursing shortage is real. And so that slide that Tim was discussing demonstrates that the increase in turnover as the leader's span of control for more employees increases, in particular on large units like med-surg, then that's where a large problem lies. On this slide, as we saw earlier, we're going to focus today on the foundation for the care structure, and the care is the celebration recognition, accountability, risk of burnout, and employee development and new hire check-ins that we will discuss throughout this presentation. Research confirms that nursing leaders need to be visible and create authentic and consistent opportunities to engage with the staff so that they reinforce goals, maintain accountability, and recognize staff for exceptional behavior and performance. And there is a statistically significant correlation in the research between nurse manager relationships with the staff and nursing engagement and turnover. This quote from George Eliot, "Great things are not done by impulse, but by a series of small things brought together." To me, this quote means intentional and purposeful actions like the ones that we just discussed on the previous slide.
And now we're going to really get into the results of some of the studies that we've been doing. And we're going to move relatively quickly because the webinar is only 30 minutes and we have a few things to share. So I'm not going to spend a lot of time on this page or any of the others, but I just wanted to say that as we go through each of these different things that impact turnover, we're going to estimate a financial impact of each one. And just to baseline those numbers for you as we see them. This is an average 500-bed hospital in the United States. An average 500-bed hospital has 1,400 RNs, certified nurse assistant therapy FTEs. It's been widely published that the cost of losing a nurse is at least $65,000, between $65,000 and $85,000. And so an average 500-bed hospital with 14% turnover is losing $13 million every year just from turnover costs alone. And so I only show those numbers as a baseline because as we talk about some of the things that impact turnover in the following slides, we will talk about the impact that we can have on a hospital just like this one. So the first section, how do tardiness and late clock-out trends affect/correlate with turnover? So the pages that we're about to show you, they will all have the same physical construct. So I'll just explain that on this page, and then we'll move a bit more quickly through the other one. So what we're measuring is, in this case, clocking out late. That could be incremental overtime, it could be time management issues, it could be a burnout indicator, but simply that they're clocking out late, they're leaving late at the end of the day. Again, looking over these, all of these nurses in the hospitals that we've been working with, and what we're asking is, how much more likely is a full-time RN to leave in the 45 to 180-day window from now, based on how much they are clocking out late today? And this chart says 6% of all those team members across all those hospitals are clocking out late more than 80% of the time. And if they are one of those nurses, they are 1.8 times as likely to leave in the next 45 to 180 days as the average nurse. So again, we'll move more quickly through the other pages, but that's what all these constructs are going look like. In other words, we're looking for indicators that are correlative, potentially predictive of someone leaving, and the idea here is if the nurse manager was aware of that, if they were thinking about it, if they were looking at it across their entire team on a regular basis, they caught it, they nipped it in the bud early, perhaps that turnover risk could be abated. And then the financial impact, as we talked about. So for a 500-bed hospital with 1,400 FTEs and a 40% average turnover rate, 90 FTEs then will be clocking out late consistently, and those have a 25% average turnover rate compared to the 14% average. And so if their manager is aware of that and effectively intervenes, such as by having a conversation or coaching or on time management, and they can reduce that excess turnover risk, that one hospital then could realize up to $655,000 a year in savings. So in other words, for each one of these, the financial impact can be large for any given one. We'll go through a few more. The next one is about coming in late. So this could be an accountability. It certainly is a fairness to coworkers as they see and their level of engagement. Across the United States, 3% of nurses clock in late more than 40% of the time, and those who do are about 1.2 times as likely to leave as the average nurse. And then, as promised, moving a little bit more quickly through some of these pages, using the same math as last time, Tom, on the next page, it would show that has abating that excess risk has an impact of up to $73,000 per year in savings.
And from a practical standpoint, we know that time and attendance systems are a very powerful tools, but extracting meaningful information from those tools can be time-consuming and cumbersome. For CNOs, it can be cumbersome for the frontline leaders. And so what Laudio does is it brings this information for you straight to the platform. It correlates these key data points to the individuals and trends those events to alert the leader of an opportunity for intervention, as Tim mentioned. This information is available in real time right at the leader's fingertips.
Well, thank you. And then next section here is on operational events such as working extra hours, working on call a lot. We know anecdotally all the nurse managers I work with think about these things quite a lot. Are we asking people to work on call too much? Are we being fair to them, but they have an impression that we're not being fair to them about the amount that we ask them to do so, and so on? And how much does that actually impact turnover? So I think you're really going to enjoy this next section. Again, the same format as the prior ones. First analysis, the percentage of shifts the nurse works than a night shift. From the very top of this chart, 0 to 10%. If you're never working the night shift, your turnover is average. The bottom of the chart, if you're working night shift all the time, your turnover rate's better than average, really. You have a good night shift worker who's happy, they stay more often. The problem lies in when we take a day shift nurse and ask them to work night shifts 20, 30% of the time. That leads to a turnover 2.6 times as high as the average nurse. And again, moving through, I know we're moving through some of these quickly, but in the interest of time, then Tom on the next page, that leads to a potential of $135,000 a year of excess turnover cost. On the next page, this one is the percentage of coworkers who are floating in on shifts. And what we're saying here is if I am a nurse on a shift and 20, 30, 40% of those on any given shift that I'm working are coming in from another unit, or they're coming in from the internal float pool, what's happening is I'm taking on a greater burden of responsibility for that for that shift. And it adds up. It doesn't add up if 10, 20% of those nurses. We know that people float in. We know that happens. 10, 20, 30% of the nurses coming in on my shift, like they're floating, not an issue. But on a regular basis, if it ends up being more than that, it leads to quite a substantial increase in turnover risk. And that alone here, just using the same math as before, leads to an excess of $333,000 a year of excess turnover risk. Now, the flip side of that is how much we ask any given nurse to float to another unit. We all know nurses dislike floating to other units. Doing a little bit, of course, is part of the job. And if it's less than 10% of their shift, they're asked to float somewhere else. Has no impact on turnover. When it gets above that, it has a substantial impact of turnover. And of course, we can only imagine as well employee engagement. So between 2, 3, 4 times as likely to leave if we ask, as a nurse manager, we ask one of our staff members to float more than 10% of their shifts. I think that one's quite fascinating, not only because it matches so much the anecdotes of what we're hearing, but now we can sort of put a number on the threshold of how much is too much, and the numbers add up substantially there. That one alone, if that could be abated, over $2 million in risk to a 500-bed hospital.
I was just going to give a personal story here. If we know that floating is a huge dissatisfier, then we can become more proactive about it. For example, I remember I was a dedicated float nurse at one time in my career, and being dedicated to that role and being a consistent person floating to units was better for the staff who worked on those units. They knew me, and I was there. It didn't create a lot of chaos of who's this next person coming and going. And that can be seen when, the chaos when different people float in and out. And as a CNO, I've worked with many leaders to become creative about float options to address this very issue. And I've lived through a number of times when staffing was made a major challenge, and I saw firsthand what floating issues do to nurses.
Hopefully we're not moving too quickly. We can take a little bit more time on the next two. I think these are two very, very interesting ones. The first one here is how much more likely a full-time nurse is likely to leave by the amount of team members that they worked with who they no longer work with now. So we've all heard of the idea of a network effect. If my friends smoke, I'm more likely to smoke statistically. It could be something similar here where as a nurse, if 10%, 30% or more of the colleagues that I was on shifts with over the past couple of months have left the organization. I'm actually more likely to leave 1.7 times to 2.9 times as likely to leave as an average nurse. And that is something, again, it's anecdotally, it makes sense. We have a lot of empathy for the busy nurse manager with a large team trying to know where all these relationships exist when people leave, the impact that it might have on other, not just the team overall, but individual specific people. But it does have an impact. And then this one affects about 9% of the team members at any given point in time. And because of the dramatic impact of turnover risk that can add, again, this is another multi-million-dollar risk reduction potential for a 500-bed hospital.
And that turnover creates RN vacancies then that, again, increases the stress on staff, short staffing, increased expense for the hospital with contract labor, and then back to the floating issue to cover those vacancies. And that inconsistency in team members also creates communication gaps, which leads to increased potential for patient safety events.
Well, this brings us to our final cause of turnover that we were going to share with you on this webinar, and I think it's the best for last. Frankly, it's my favorite. We'll see what you think too, Dana. But this one's really about everything we've shown you up to date has been effectively the stresses on the life of a nurse and how and try to talk throughout the ways that a nurse manager might identify them in real time and perhaps intervene with a conversation or coaching discussion. This one's a little bit different. This one is an opportunity for leadership development among staff and the impact that has on turnover.
Right. I think that this is showing that giving the nurses their first shift as a charge nurse has virtually no turnover in the following few months. So the point of this, and then also on the next slide, if you want to move to that one, is that we're giving nurses more autonomy and asking them to participate in decision-making, giving them professional growth opportunities, then therefore they're a lot more satisfied. Nurses who are recognized and valued then are empowered with purpose, they become more resilient, and you can enhance their performance through those things, and they exert more discretionary effort with their jobs. The thing I love about this, too, is the research shows that there's a positive correlation with nursing engagement and patient satisfaction. So when we engage nurses on the front line to help us with decision-making and we empower them to take on larger responsibilities, then that passes on to the patient satisfaction. And we can see that the savings there in reduction and that turnover risk is more than $500,000 a year.
Well, one of the things I was going to add is that, Dana, you outlined the CARE framework that we use, and we know people are using recognition tools and people are celebrating and birthdays and anniversaries and milestones, and we're looking at accountability and we're looking at risk of burnout. But I think the employee engagement and what you can do with employee and career development and professional development is a really important piece of this, because people want to feel valued. They want to know that their leadership cares about them and their career and what they're doing on a daily basis. So I think that's why we bring this into our framework, and these are some of the insights that we deliver to nurse managers so they know and can identify, with a click of a mouse, who these people are. So I think it is an important one that we added at the last minute we thought people would be really interested in seeing this. So what I wanted to do is show, I've added this slide because our launch cohort, who we've had ample enough data to be able to track and record, this is working. So when nurse managers get the information at their fingertips and they can act upon it in a really timely and relevant manner, whether it's sending an email or a text or seeing that they're on the floor and going to have that conversation, again, with the CARE framework, it could be an affirmation like, hey, you're doing a great job and you need to know that from me. Or it could be, you may want to use the word intervention, where you're going to do something that might intervene and stop someone from considering leaving, because everyone wants to know that their manager or the leaders on their team care about them and what's going on in their situation. So this was one where we've actually seen, compared to the baseline, a significant decrease in turnover across the board. So we're proud of this, and we're actually bringing this to publication. So, And then, Dana, you talked about the platform. This is not a demo, and I know many of you on the call have actually met with our team and had demos of how the product works. But you can see it's a one-stop for the nurse manager and also for the CNO and the leaders that are looking at the nurse managers and their activities. But this is a one-stop where you have everything here, and you can see Laudio's top 10 recommendations, for example. This is where you get those insights. It's not like you're digging. I mean, Dana, talk to me about maybe how you think it works now for those sort of motivated nurse managers that want to get in and get the data.
Right. I consider Laudio as part of a daily management system. It just makes the leader much more efficient in doing the things that we need to be doing every day anyway. It puts all of the information right there in front of you, whether you're using the phone and the web-based platform, an iPad, whether you're in the office. It just brings all the information right to you, and it makes you more efficient in giving that feedback, coaching, recognition, reinforcing messages that we need to give to the staff. And also, all of that information is stored and collated right here for you to use later when you need it.
Exactly. So Dana has provided her notes for us and her references, so those are available too. That actually concludes the formal presentation, but we did, we're coming, I look at the clock here. We have a little bit of time for questions. 3 of them have come in advance of this ending. Dana, this one's for you. Someone said, I read your blog interview. I think that was the one that was in pre-check a couple weeks ago. Can you tell us how you see these insights, how these insights are at the intersection of nursing and HR?
Yes. Laudio helps HR and the chief nursing officer become more aligned on accountability. And we've all been there where we've lacked documentation that we know we need for our HR records. And so here's where HR and nursing leadership can really lock arms and be aligned on what we need. The information is very powerful for understanding trended issues that need to be addressed, like if you've got time and attendance issues, as Tim mentioned, or if you've got lots of floating. That information is right there for you to identify specific areas that you need to address or for people that need to be recognized. And then having that there can also empower the C-suite to go and recognize people. If they've gone above and beyond and they need recognition up to the level of the C-suite, I think that's a powerful way to also engage and give staff some recognition that they need.
Agreed. This question came in when Tim was talking about setting up the research, so I'm not sure if you answered it, but we are a suburban community hospital, but I feel like these are true for our experience. What type of hospitals were in the study?
Yeah. Yes, we had a mix. There were a number of community hospitals in here. Out of the 12, 8 of them were community hospitals, 2 of them were urban academic medical centers, and I think 2 of them were urban tertiary care facilities.
All right, great. And the third question that came in, I think both of you could answer this, but Dana, as a former COO, do you see this being used in other departments besides nursing?
Absolutely. We know engagement and turnover are concerns in areas outside of nursing. So the lessons we're learning through the nursing implementation of Laudio can be cascaded easily to other departments. Nursing then can become the champion in teaching other department leaders the valuable insights that they've gained from using Laudio.
Great. And Tim, I know you could actually add to that because we get asked that all the time as we meet health systems.
We are working with a number of hospitals now where we're deploying this into clinics, cancer clinics, ambulatory clinics, and increasingly to other roles, certainly certified nurse assistants and therapists, of course, but considering as well moving out a bit out into the non-clinical roles. So I actually think the story is very similar. We will have our first and primary focus on the nursing and the clinical workforce, but I do think the story ends up being similar.
Terrific. And actually, with I think a minute left, Dana, I'm going to field this one to you. Do you think that having these analytics can impact quality, patient care, or improved outcomes?
There's no doubt that improving frontline nursing engagement and increasing stability of our workforce has an impact on patient safety and quality. There's some very wonderful current research that shows Engaged and optimistic nurses are more effective and resilient in their roles, and in turn, they translate that energy into behaviors that improves patient safety. They're more alert and attentive to those. They speak up more, and then we also enjoy greater patient satisfaction when we have those types of nurses.
Excellent. Deborah just typed in a question. She wants to know about the slides, if they'll be available. We're actually going to reach out to everyone that attended with access, and we will present that to you after this ends within a week. So that actually takes us to the end and the 30-minute mark. So Tim, I wanted to thank you for, I know I asked you this a few months ago when it was being developed, if we could share it with an audience. So I'm really glad that you said yes, and I'm sure the people on the call are appreciative too.
It was a lot of fun. Thank you.
And Dana, thank you for your expertise and, continued support and helping us with direction and keeping us, with the lens of the user. So we really appreciate that.
Absolutely. Thank you, Tom.
All right. And everybody, have a great rest of your day, and we will talk to you soon. Thank you.